Okay, fab. So I will get going. So thanks everyone so much for coming today. This is a technically a Trans Day of Visibility event, although Trans Day of Visibility was on Monday. So sorry that we're fashionably late to that, but there was another big event that lots of people in the sector were going to. So we thought, fine, hold our trans event not on the actual Trans Day. But today we are going to sort of run you through about a half an hour-ish presentation, depending on how quickly I talk, of our Scottish Trans and Non-Binary Experiences Report, which is a big piece of research that we published last year. If anyone doesn't know, we're Scottish Trans, and we are a project of the Equality Network, which is a Scottish LGBTI organisation. And we're a charity that works to improve trans rights and policy and inclusion in Scotland. We do reports like this, we do policy work, we advise organisations all across Scotland on how to best include trans people, and we just try to make Scotland the best place it can be for trans people. And our email addresses are there on the screen, but I think we'll put them in the chat as well. So if you ever want to chat about anything trans related, basically at all, just pop us an email. Always happy to help. So I'm going to get going now. And we're also, as I just mentioned, recording this session, but that's just so we can put it online. Your cameras and videos will be off, so you shouldn't be included in the recording. So on to the report itself. So we occasionally do pieces of data collection and reporting like this. And so we started about doing this trans non-binary experiences report because we know that things have been really tough for the community in the past few years, especially tough. And we've heard a lot of anecdotal evidence from the trans people that we work with and speak to about this. But we thought it'd be really helpful to try and capture some of that specific experience in sort of hard data so we can really use it to push the work that we do and inform the work of other bodies like the Scottish Government, and also try and make recommendations based on those experiences to try and tackle some of the barriers that we know people are facing. We also noticed with a lot of sort of new research on things like the cost of living crisis, there was big barriers in like Scottish specific data and then also in trans specific data. So we thought as Scottish trans, we'd probably be quite good to do this reporting. And as you can see, there's sort of two different versions of the report. There is like the full research report, which I think ended up being like 170 pages long. As soon as we realized we were not actually going to print it, we just kind of went a little bit wild. So if you're a big data geek, there is a lot in there for you. And then there's the shorter summary report, which is about 30 pages, which is sort of some of the content that I'm going to cover today. That gives you really the headline stats on each of the 8 sections of the report. And each section also has a full set of recommendations that we tried to make as practical as possible and that are really based on some of the things that people told us and the results we got from the survey. So we haven't just pulled them out of nowhere. And also, when we've asked questions, we tried to base a lot of the questions we asked on like other pieces of data and bodies of evidence. So as much as possible, we've tried to make it so this our results can be directly compared to the general population. So we heard from 571 trans and non-binary people living in Scotland between March and July 2023. We hosted an online survey, and we promoted it online extensively, but we also did posters and flyers to try and catch people who don't normally follow our social media presence. We 571 maybe doesn't seem like a huge number. It's quite big for us, but also fortunately, just before we published this last year, the Scotland 2022 General Census data on sexuality and gender orientation came out. It said that there was 19,990 trans people living in Scotland as of 2022. So our sample of like 571 people is the equivalent of about like 100,000 people compared to the general population of Scotland. So that is a pretty big data set. We did also get people from right across Scotland, 31 of 32 local authority areas. The one we missed, I think, is East Dunbartonshire. Don't know what's going on with the lack of trans people responding to our survey in East Dunbartonshire. If anyone knows, please let me know. And around half of the people we heard from were living in urban areas. So we hopefully have a good representative sample of people living right across Scotland. 67% of the people we heard from were disabled. We used a slightly modified version of the definition of disability used in the Equality Act, just to make it clear that this includes things like physical disability, mental health, and also neurodivergency. That is quite a high number, and I'll talk about that more on the next slide. A lot of general estimates indicate that around 20% of the population is disabled. So we knew that we had a high sort of overlap within our community, but that is quite a significant number. 10% were from Asian, African, Caribbean, Black, mixed, or other ethnic groups. And our survey did skew a little bit younger than the general population, but that is also consistent with the ages of the people from the general census. So it just does tend to seem that people who identify as trans and non-binary or are willing to sort of openly identify that way are a bit younger. So that's something to keep in mind when we're talking about the findings from the survey. So specifically on disabled people, as I mentioned, 67, so quite a large portion did identify as disabled. And we did actually find that when we sort of compared the results of our respondents who identified as disabled versus those who didn't, they're quite often quite significant differences between those experiences. So, for example, about half of disabled people we heard from were employed compared to three-quarters of non-disabled respondents. And those who were employed, if they were disabled, earned less than non-disabled respondents. And around 29% of disabled people had been homeless compared to 13% of non-disabled respondents. I think something that came up often that we will also be producing a separate report on to sort of highlight the experience of disabled people was that I think something that people often find when they belong to different like marginalized groups or have different marginalized experiences is that you have instances where barriers that you face for each of those identities sort of compound. So you experience barriers because you are disabled and because you are trans, and that like doubles the amount of barriers that you face. But also we found that people did experience very specific intersections because they belong to those two groups, sort of like the middle of the Venn diagram, if you will. And so that is something that we're going to go into more detail with in this disabled report, but I'll pull it out as well as we go through. So into the sort of meat of the actual report, we asked about 8 different areas, I believe, and we split them up into 3 parts. So this first part is public services, GP practices, and neighbourhoods. We also asked about in part 2 about housing and homelessness, and then in part 3, we asked about work benefits and the cost of living. So I'll go through each part in turn and talk about the recommendations for some of each one. And then as I said, hopefully it'll be about 20, 30 minutes, and then we'll have some Q&A at the end, which Vic will be answering because I will be very tired from having spoken for half an hour straight. But we'll see how we go. So for public services, we asked about a wide range of different services. We wanted to know about things that people use every day. So we asked about things like public transport, public toilets, pharmacies, for example. But we also wanted to know about places that people went to when they needed support or when they were in a crisis. So we asked about things like food banks, Citizens Advice Scotland, and the police as well. So each of these does have a section in the full report if you are interested in finding out more. You can sort of see on the graph on screen, hopefully it's just about visible. There's a bigger version in the actual report. We've sort of arranged them from the sort of most to least satisfied with people who had used them. So at the top were sort of public spaces like parks and pharmacies, and maybe not surprisingly, at the bottom is public toilets and the police. For public toilets, it's perhaps kind of obvious. It's quite a big flashpoint in the media, but it's also an area where like society suddenly becomes very gendered. So if you are kind of like moving between those categories, it often becomes a very difficult place, and also a place that people are really concerned about what might happen if they go and use a public toilet. And then also Police Scotland, many people in our community are worried about how they will be treated if they report something to the police. They feel like they won't be taken seriously, or they've had negative previous experiences, or they know someone who has. And I think this comes up a lot throughout the report, is that when you're part of a sort of small minority community like the trans community, even if you haven't experienced something negative yourself, if you know someone who has, that can really like have a big chilling effect on your willingness to use that service. And we did find that 61% of people have avoided at least one public service out of fear of being harassed, being read as trans, or being outed. So that is quite a significant concern that people have, and it really like does lead to trans people in many ways, like retreating from everyday life. Often people told us that they were too scared to go outside or to say use public transport. And if you are, say, worried about whether you're going to be able to safely use the toilet or not, it really reduces the amount of time that you can be outside the house at all. We also did here ask people about the negative experiences that they had experienced within these services, and 54% had had at least one negative experience. So that's things like harassment, verbal abuse, threats of violence, outing, but it also does include physical violence and sexual violence as well. So that is at least half of people have had those negative experiences. So it isn't just a fear that they might happen. And throughout our report, we also included direct quotes from people who responded. We gave people sort of like free comment areas below most questions. And I think it's really important. I won't read through all of them, but these are sort of representative of some of the different kinds of experiences that people had in public services. So people felt very judged. They felt like people were suggesting that their identity and who they are is just like a lifestyle choice. And people felt deeply unsafe, and that affected their ability to go about their daily life. They felt like there weren't appropriate services for them or for other people. Obviously, there are some services that we might use that are specific to us, but we are also affected, just like anyone else, by a lack of public toilets or other sort of like community centres. And again, people have real mistrust of services like Police Scotland because of their prior poor treatment, because of the sort of systemic attitudes of an organisation, or also the experiences of other people they know. We asked about GP practices separately from the rest of the public services, because they can kind of be the sort of first step in people's journey to getting gender affirming care. So we knew people would have quite a lot to say about them. Um, but because they're that first step, they also can be the first barrier that people experience. So we did ask people about the overall rating of the care provided by their GP practice. And as you can see by the pie chart on screen, it's sort of roughly in thirds, with like 40% saying excellent or good, 33% saying fair, and then 28% saying poor or very poor. So I think when I first saw this, I was like, maybe that's not so bad. But when we compared it to statistics for the general population, 69% of the general population rated their care as good or excellent, whereas 40% of our sample, so almost half, rated it as good or excellent. So that is still quite significantly below the general population. And you can see on the right that some of the key themes that people experienced were difficulty booking appointments, poor treatment by staff as well as GPs, issues with shared care. So shared care is when a GP will agree to perform certain services, so like blood tests or providing prescriptions for people who've sought private gender affirming care. It's often for people who are on the very long waiting lists for gender affirming care on the NHS, and who are seeking care privately to sort of help mitigate that. And then also issues with administrative changes, such as changing your name or your gender on your NHS records. So some of these, such as the sort of poor treatment and the difficulty booking appointments, aren't even like particularly unique to trans people. I'm sure everyone here today has had difficulty like actually getting a GP appointment in a timely manner before. But again, it's kind of the way that when you have uh, issues that everyone faces, as well as specific issues because of your identity, these things all stack on top of each other. And we also found that with things like poor treatment, because of being trans by your GP, people said it did make them less likely to go see their GP for other issues as well. So issues they had that were completely unrelated to being trans, they were less likely to get care for, which usually leads to worse health outcomes. Um, it's not completely all doom and gloom, although I apologize that a lot of this presentation is quite doom and gloom. Um, there were some examples of like good treatment and good examples, and people who had wonderful things to say about their GP, which is obviously all fantastic. And it is great to hear that. But of course, everyone should be able to get quality care from their GP and get referred to appropriate gender healthcare. You shouldn't have to have like Wonder GP for that to happen. And then finally, in this section, we also asked about neighborhoods, like people, how people felt about the sort of like immediate area around them if they were in a city, or their sort of wider area if they lived more rurally. 65% of people we heard from rated their neighborhood as good or fairly good. Again, sounds quite good until you compare it to the general population Scottish household survey, where it was 95%, where almost everyone rated their neighborhood as good or fairly good. And something that came out in the sort of like the comments that people left was that even if people felt like their neighborhood was like a nice place to live, they didn't super feel like included. There wasn't a great sense of community cohesion, and we'll come on to this later. But that also does it doesn't. It's not just like a nice to have. It does impact people's ability to access like local support services in their area. And 59% of people did feel that their trans status had an impact on their experience of their local area around where they live. So for 7% of people, it was only positive, and people did say that like seeing other like visibly trans or other visibly queer people or flags or stickers in their area did make people feel like welcome. And they could sort of see themselves reflected in their environment. 29% of people felt like it was sort of mixed, positive and negative, and 23% of people said it was only negative. So we did hear about people who did experience things like harassment and abuse, or even just like stares and generally feeling unwelcome. But also interestingly, lots of people told us about how wider sort of discourse in the media, on social media, on the news, in politics, actually made people feel more unwelcome in their local area, even if they hadn't experienced that kind of antagonism. I think perhaps just the sense that that was a widely held opinion, or that people did feel that way in Scotland, made them feel less safe. And also specifically, people talked about things like anti-trans stickers in that area and really made people feel unsafe as well. So onto the recommendations for part one. Definitely these are ones that would be great for everyone, is more public toilets, more safe and inclusive community centres and other community spaces. We have actually used some of the data from this survey when speaking to both Glasgow and Edinburgh City Council about improving public toilet provision for everyone, which is fabulous. Staff in public services should have trans and non-binary awareness and inclusion training, and be aware of and address risks to trans and non-binary people's safety when using services. Training is a big recommendation that comes up throughout the report, and it's definitely not just because we also provide training, but we do if you're ever interested. And specialist gender identity services and GP practices should collaborate on shared care agreements, and GPs should ensure that decision making about those agreements with private providers isn't done in a non-discriminatory manner. Again, there's more on this in the full report. And work on community cohesion by local authorities should consider the isolation and harassment that we face, provide increased funding for trans-specific social and wellbeing services and support. So on to the second part, which is housing and homelessness. These are obviously very closely tied together. When we asked about housing, people told us, we found that people were twice as likely to be renting privately compared to the general population. So 32% of people we asked compared to around 13% of the general population, and then half as likely to own their own homes. So 33% compared to 65%. This is another one where, of course, like it's important to consider that our sample does like skew younger than the general population. And of course, younger people are probably less likely to own their own homes. But we did still find significant issues with this one. We did control for age. So it does seem to be a wider issue across the trans population, not just because we're a little bit younger as well. Um, and also, we heard that 15% of people had experienced problems staying in housing due to being trans or non-binary. One of the most frequent reasons for this was actually unsupportive families. So familial rejection kind of creates a big problem for a lot of the other sections of the report that we'll talk about, where people don't have that like safety net if they struggle to, say, pay rent or find a job or access benefits. And yeah, so lots of people were saying that they were forced to leave their family housing simply because they were trans. We did also hear about harassment that people experienced from landlords and from the other residents as well, and housemates and things like that. But as well as that kind of like interpersonal harassment, we did also hear a lot about of sort of more systemic issues that people experienced. So people had problems with the ID that they used, if they had ID that was in different names or under different genders. And people generally had like very different experiences. And like inconsistent experiences with lots of estate agents, for example, not really knowing what the deal was. There not being clear policy on this, and that meaning that lots of different trans people were not getting consistent or fair experiences. And it is perfectly legal to have documents in different names as long as you're not trying to do active fraud. I think the quote here does kind of sum up a lot of these issues. I went from being a top candidate and ideal potential tenant to not suitable as soon as I arrived at the property. It was very clear immediately that I was not who the letting agent expected me to be. I was verbally discouraged from applying. So it's very clear in this instance that the only real issue is that a person is trans. And of course, we also did see significant differences between the experiences of disabled people with housing and non-disabled people as well. So as you can see, 30% of disabled people were very satisfied, 49% of non-disabled were very satisfied. Twice as many disabled people were in precarious living situations, and much more were worried about their next mortgage or rent payment as well. And something we sort of are aware of is that, like, if people are experiencing difficulties or harassment with their housing, for disabled people who need specific accommodations within their housing, especially if it's social housing, it's really a lot harder for people to leave those like difficult areas or situations because like good accessible housing is like gold dust and it's really hard to come by. So people are struggling because of that specific intersection of their identities. And of course, difficulty with finding and staying in accommodation does also lead to big issues within the community with homelessness. So 1% of the respondents we heard from were currently homeless, and 23%, so nearly a quarter, said they had been homeless at some point, and that's compared to about 8% of the general population of Scotland. We did try and use quite an inclusive, wide definition of homelessness, and we worked with homelessness organisations to ensure that this was accurate and representative. Obviously, lots of people think of just street homelessness when they think of homelessness, which is a huge issue. We wanted to make sure that this was like a wider definition to include people who were like staying somewhere that they had no right to be, or were like sofa surfing, as lots of people who only really get support from like other members of their community might be in these situations and they might not think of themselves as homeless, but they have no real sort of right to stay where they are, and that puts them in a really precarious and vulnerable situation. Um, and also, of the people who had been homeless, 40% had been homeless more than once, which is huge. And 35% felt like their trans status had contributed to them being homeless. So that's around a third of people. As you can see on the left, some key themes again, familial rejection for reason for homelessness, but also gender-based violence, discrimination from landlords leading directly to homelessness, and then also discrimination at work. And we'll talk more about that in the next section. Of course, difficulty finding and obtaining work, difficulty finding and obtaining benefits means no money for rent, means homelessness. We also heard from lots of people who had been homeless. 45% had never made a homelessness application, or 20% only did it sometimes. Lots of people said that that was because they were scared about what would happen to them, that they would experience discrimination within these systems, but also a lot of people said that when they had applied, they didn't apply again the next time because it wasn't really appropriate for them, they didn't get the support they needed, or they had particular difficulties within homeless services that are often quite gendered. Um, so our recommendations for this section, the first one is again one that would be great for almost everyone, that the Scottish Government should do more to increase the availability of safe, affordable, accessible social housing. Again, we do have some very particular things that we struggle with, but just more accessible social housing would be huge for a large part of our community that really needs that. Local authorities should recognise familial rejection as a significant risk factor for homelessness and take that really seriously. There should be much more support for people who are experience housing discrimination to make complaints about this under the Equality Act. Housing providers of all sorts should take those reports of transphobia seriously, ensure that there are clear policies about proof of identity so everyone gets the same treatment, and organise trans awareness training for staff so they understand some of these issues, how to deal with them, and also how to respectfully work with trans people in their services. We have produced a sort of mini housing resource, like it's like 4 pages long, sort of outlining a lot of this, also exactly what housing providers, both private and social, can do in these situations. That is up on our website in the resources section, and I think Vic will pop it in the chat as well. Um, and then we're on to the final part. So we're nearly there, on work, benefits, and the cost of living. So on work, we did find that quite a large percentage of people, 38% of people, said that they did not currently have a job, and 26% had not had a job for at least 5 years. We sort of have to give a big caveat here that we just asked people whether they were in work or not. And our sample does include people who may not have been working for other reasons, such as people who were retired or could not work. So it is a little bit more difficult to compare that to sort of general um, uh, statistics about the working age population. And so it might be more accurate to compare it to things like economic inactivity. And we have a full page in our report breaking all that down at the start of the work section. So again, if you're a big data nerd, that's all there for you. Um, Still, it does seem like it is a significant issue within our community and does seem like a very large proportion compared to those sort of like general population statistics. And we did also find that of those people who were in work, around a third were in more precarious employment, working on jobs with like 0 hours or short-term contracts, for example, and also people had a much lower like median income than the general population when they were as employed as well. Um, so we also asked people about the kind of experiences that they'd had within the workplace, and 42% said they'd had at least one negative experience. So this does include things like harassment, it includes exclusion from opportunities like promotions, it includes having to leave a job or career, and it does also include the threat of or actual physical or sexual violence as well. Um, we also found that there was then big crossovers between like the multiple different parts of people's identity when it comes to how they were treated at work. So people were treated more poorly because of disability, of course, because of gender or the perceived gender that they were. Their age was a big one, sexuality, but then also race and ethnicity. And we really just found that people struggled both in the process of getting jobs because they were trans, and then also staying in the workplace was difficult as well. Again, there's a good quote here that sums up a lot of the different ways that people are excluded. So I'm looking to leave my job because I can't cope with the transphobia and constant gossiping of people. They think it's okay to tell people my past without my permission, so out somebody without their consent. I've been excluded from job promotion opportunities, bullied by my manager, and outed to everyone in the organization. I really feel for this person. It sounds like they've gone through all of the negative experiences that we asked about. But this is the reality of what people face when they're just trying to work like anyone else. For this next section on benefits, I also wanted to include these quotes in the presentation as I feel like fortnightly experience in dehumanization and trauma could be it's the title of a completely separate report on benefits. I'm sure anyone who's had any experience with the benefit system knows that this is very accurate to almost everyone who uses the benefit system, not just trans people. But we do, of course, experience our own significant barriers as well. Of our sample, only 41% had never claimed benefits, with a third currently claiming and a quarter having done so in the past. And these were also much higher, as you might expect, for disabled respondents. So 45%, nearly half of disabled respondents were claiming benefits, compared to 7% of non-disabled ones. We did ask about a variety of different benefits providers. So we asked about the DWP, HMRC, job centres, and Social Security Scotland. And again, there's a much more detailed breakdown of how people felt about all of those different services and recommendations for all of them in the full report. Just don't quite have enough space to go into them today. But in general, people were very dissatisfied with the inaccessibility of these services and just the general sort of like lack of care they experienced across different bodies. People made to feel lesser for seeking benefits. There are also 13% of people felt that being trans had had a negative impact on their ability to claim those benefits. And there is also there's a few specific issues that trans people face, but a really big one is having often our benefits records locked and being only accessible to a very small number of people within HMRC and the job centre. This is, in theory, for our privacy, because if you change your gender on your sort of national insurance record, they do put a special lock on your account, which is basically to stop people from sort of snooping and seeing that your gender is different from your assigned sex, which is good. But it does unfortunately mean that if you have a problem with your benefits or you go to sign on, only a very small amount of staff in job centres can actually like see your account and see what's going on. And because it's a very small number of people, they're very busy. And so if you go in with a regular issue to a regular job centre, it could be weeks before someone actually gets around to helping you on it. So it means that even if trans people are facing issues with their benefits that are completely unrelated to being trans, they might have to wait much longer to get those resolved. We also did notice that, of course, disabled people had complicated access to benefits, as well as trans people, but then these two also really compound, as if you're then looking for a job that is accessible to you as a disabled person and can meet your reasonable adjustments, but where you also sort of feel safe being trans in that workplace. And then you also have to explain to your job coach why you might only be applying to a few jobs or why you don't feel safe working in particular jobs. And that involves coming out as trans in an environment that doesn't feel very safe. So, sort of every part of the process can be quite difficult. And lots of people told us about no longer claiming benefits when they really needed them, because it was just a deeply hostile and dehumanizing environment. And then finally, we asked people about cost of living crisis. Obviously, the cost of living crisis has impacted everyone in different ways, but did affect us in some very specific ways. So 86% of our samples said they were affected either a little or a lot by rising costs in the past 12 months. Again, that's affected almost everyone in Scotland and across the UK. But when we did ask about decisions people had to make between essential household costs and costs related to transition, 52% of people, so just over half, said rising costs had caused them to make those difficult decisions. So people told us that they were simply skipping meals or not turning the heating on, or not going out and seeing friends and doing social things because they simply didn't have the money and they needed to save it for costs related to their transition. And this does directly tie into the very long wait times for gender affirming healthcare on the NHS in Scotland. So in the Sandyford Clinic, which serves like the largest number of people, the wait can be at least 5 or 6 years. I think I'm 6 years now. I've been on the waiting list and still not had my first appointment. So it is incredibly long for people to access essential care. So many people who feel like they can't wait any longer do make the decision to go private. Again, people have big difficulties accessing benefits and work. So lots of people don't have that money. And so those NHS waiting lists, cost of living crisis is really having a significant impact on their quality of life. Um, but also, again, we found that people were roughly split on whether they thought that they would get support around the cost of living from their local community, which is kind of where that bit on the neighborhoods that we talked about at the beginning comes in. If people don't feel welcome or safe or included in their local area, they aren't going to reach out to the sort of resources that are available, like things like food banks in that local area that could support. So people, again, feeling really isolated and this having significant impact on their health. So our recommendations for this section are that workplaces should create inclusive and accepting cultures and environments for trans people, including supporting things like LGBT staff networks and equality champions, as well as implementing trans inclusion policies to sort of pick up this accepting culture. This is something that for some reason I'm really interested in. So if you're ever interested in implementing a trans inclusion policy within your organization, please pop me a message and I'll do my best to help. We Staff working across benefit services should have training on trauma-informed approaches to working, as well as trans and disability inclusion training and understanding the different ways that these all overlap and create barriers for people in claiming those benefits. There should be clear policies for name changes and providing identity within the benefit services, but also even within workplaces as well. DWP and Social Security Scotland should review and improve that special customer record system that I was talking about that locks people's accounts to make it much more accessible. And community services that do seek to mitigate the cost of living should ideally have trans inclusion training and try and communicate to local trans and non-binary people that they are welcome to use those services. So a little pride flag can go a long way on that one. So fortunately, that's pretty much the end of the presentation. The report was released last July, and it's really driven kind of like all of the work we've been doing since then. So we were doing things like this to try and share that information and make sure that people are aware of what our community is experiencing in Scotland right now. But we're also planning a few more sort of spin-off guides. We did do the housing guide that I mentioned, which is on our website. We're doing that sort of smaller, focused report on disability and working with disabled people's organisations on that. We're going to produce a guide on self-advocating at the GP, how to change your name and gender on NHS systems, as that's a big knowledge gap in the community. I'm working on a big guide on trans inclusion in the workplace. And again, we will be working with lots of different organisations to make those things happen. Um, yeah, I think Vic will put some links in the chat if they haven't already, but the full report and the summary report are on our website as well. And please feel free to pop us an email if you have any questions about that or if there's anything you would like to discuss. So that's it from me. So I'm going to hand over to Vic now to do some Q&A. Thanks so much for listening.
Thanks, Lou. That was fabulous. Well done for getting through all of that. So I have been diligently trying to answer some people's questions as they've been coming in, but I have not managed to get to all of them, which is good because it means there's some to do now. So first up, somebody has asked if there were similar experiences with devolved benefits, if anyone answering the survey claimed them versus just kind of UK administered ones. So we didn't ask about experiences of specific benefits. Instead, what we did was we asked about how people would rate essentially the different like bodies and agencies administering them. So we asked about DWP, helplines and websites, the same for the HMRC, the same for Social Security Scotland, and also about job centres and local authorities. So it was more kind of about people's engagement with the people like dealing with claims and administering the benefits. Social Security Scotland was the most favourably rated of all of those things that we asked about. I think even including just about having a net positive rating on using their website, but even then, only just. And so essentially, really, what we found out was that it was the least of all the bad options, but across the board, people really weren't very happy with either, well, with any of the bodies they were having to use around benefits. Somebody has also asked if difficulty getting a gender recognition certificate is a barrier around interacting with the Department for Work and Pensions. So the answer to this is sort of yes and no. So for people who don't know, a gender recognition certificate is what lets a trans person update their birth certificate from female to male or male to female. Those are currently the only two options. And one of the only places that requires you to do this before you can update your gender marker is the Department for Work and Pensions. So things like passports and driver's licenses you can update without one of these gender recognition certificates. But if you want to update your gender marker with the DWP, you've got to have one. And what the DWP will do, though, before you have a gender recognition certificate, is it will change your title and it will change your name. But that then leads to the problems Flo was describing, because then essentially what you might have is you might have a record that, to try and pick a maybe very obvious example, that says sort of Mrs. Sarah Smith, but then in the sex marker field it has an M. And so it means that anybody, every time they looked at your DWP record, it would be really obvious that this is almost certainly the record of a trans person. So what they do to get around that is they lock your record so not everyone can see it. And that's kind of when you get into the problems around phoning up for your benefits and nobody being able to answer the questions. We have got a question about tips for getting employers, particularly small charities, to fund trans inclusion training. Nobody quote me on this, but my tip would be, if you're a small charity, ask us, and it might be that the fee is lower than it might be for other kinds of organizations. So it might be that we can help you with that, depending on the situation. We have a small amount of budget each year to provide free training to people. And obviously, we tend to try and ring fence that for organizations that wouldn't otherwise be able to afford it. It is relatively small, so please don't 50 people get in touch asking for free training, because I'll have to say no to at least 48 of you, I would imagine. Somebody has asked if anybody mentioned, in terms of the kind of interaction between cost of living crisis and access to gender identity services, specifically the costs around travel. So again, probably plenty of people on the call don't know that for most kind of surgical interventions that trans people might access as part of their medical transition, if they want to do so, many of those are provided in England. And although your local health board will fund the cost of that in terms of your travel and accommodation after you've had the surgery, you have to do that up front yourself. And obviously, for some people, particularly if you're traveling from the Highlands to the southeast of England, it's a phenomenal amount of money to cover up front. The honest answer is a few people mentioned it, but not loads. But I think realistically, the survey reached 570 people, and given the state of waiting lists, not only for first appointments, but then for surgical appointments, there's probably not that many for whom it's a live issue to talk about. But a couple of people still did, which, given the size of the sample, means that, yeah, it definitely is a problem. Um, we have a question about if we've got plans to work more with research further with trans people in rural areas. We had a look at the data to see if there were any statistically significant differences in kind of experiences between the people who were in kind of remote rural areas versus people living in urban areas, and there actually weren't any, which I was really surprised about. And we would have definitely highlighted them if there were. As part of the wider kind of equality network organisation that Scottish Trans is a project of, we have done a lot of work around kind of specific issues facing people in rural communities that maybe have less access to kind of specialist support services and things like that. So it's definitely something that we know is really important. And this year, in terms of thinking about our Pride engagement and things, we're definitely going to be majorly focusing more on those communities, perhaps where they're less likely to see trans equality organisations than perhaps some of the larger cities in the Central Belt. But yeah, I think the only place I can think of where it came through in the qualitative data was that quite a few people mentioned, in terms of talking about their GP practices and how they'd rank them. A few people kind of talked about the perhaps lack of choice if you had bad experiences with GPs and you were living in a more remote location, and similarly around neighborhoods as well. If a few people mentioned that sense of if you've had a bad experience in your local neighborhood is a small remote place and there's not loads of options in terms of moving around in the local area, then that could be an issue. Um, Current work being done to improve trans people's access to and influence on public life, policy, and communities. What I'm going to do is I'm going to promise to give you my good spiel on that via email after the presentation because it's not one that I thought about in advance of today, and so I'll answer some of the other questions first. Okay. Um, okay. John has put in a bit of information around an earlier question about the provision of trans healthcare by private health providers that I will also post in the chat in case anybody is not carefully paying attention to the question and answer box, which would be entirely fair enough. It is totally fine to share the slides with people who weren't able to make it today. Please do. We would be very happy for you to.
Yes,
Um,
we'll send a copy around with an email after the event.
Issues changing names on pension details or simply a case of changing everything with HMRC? So it can depend a little bit on if it is a private pension provider. As a rule, we haven't heard a lot about trans people saying they've had issues around their pensions. I think in particular now that the age of being able to claim state pension has equalized, it would be almost I mean, it's probably technically possible, but it's probably close to impossible that a person might exist where their change of gender marker would have an impact on their pensionable age. And I think there might have even been an EU case won anyway by a trans woman without a gender recognition certificate about being able to claim her pension at the same age as other women anyway. But theoretically, yeah, if you've got a gender recognition certificate and you have updated your details with DWP and HMRC, everything that flows from that central bit should then kind of be neatly happening all in a one. Thank you very much to the person from Edinburgh Coalition Against Poverty for sharing your details. We will definitely check those out and be in touch about ways we can work together. Um, Then, last question. Well, there's 10 minutes to go. So if anybody has been sitting on one that they're desperate to ask, please do ask it. Have we completed any research on trans experiences of accessing specific health services, e.g., cervical screening? Yes, we have, in the sense that so we ran a couple of focus groups quite a few years ago now. I want to say maybe even as far back as 2018 on behalf of Public Health Scotland when they were implementing or working on the last iteration of the national screening standards. But there's also been quite a lot of good quality research done that's peer reviewed specifically on barriers to accessing cervical screenings. And we contributed to a paper that I cannot remember the name of the particular bit of National Services for Scotland it was now, but I know it was circulated widely within NSS and with screening colleagues around what some of the barriers trans people face to all of the sex-specific screening programs. But definitely get in touch with me and we can talk about it more because there'll be loads of things I'll be able to point you to on that, I think. So let me reach up my email address in the chat. Um, we probably will try and do the survey again on a pretty regular basis, as with any piece of research that I think a third sector organization does. You realize one, that designing it and doing it is maybe a quarter of the battle. Finding the time to write it up is really the big one. But the other thing I think we found as is tends to happen with survey design anyway, I think is that there's definitely a few things we'd change just to make it a bit more comparable with the some of the data that's available about the general public, particularly around employment figures, I think. But yeah, I think we'd probably like to redo it about every 3 to 5 years, as I think it's a good kind of benchmarking piece of research, particularly because of the breadth of that we asked about. And thank you, Tammy. That's very kind of you. Mm. Okay, a question around has there been surveys of trans youth around education, home life, and lack of access to trans healthcare? There, yes, is the answer. LGBT Youth Scotland published their Life in Scotland research last year as well, I think, or potentially at the very end of 2023, but I think it was last year. So that has similarly, I guess, to what we've done, there's one big research report, but there's also some specific broken down topic areas of focus. Healthcare and education are indeed two of them. So that's probably really good research to look at. Like Flo mentioned, our sample did skew young, although I mentioned in answer to one of the other questions that it skewed young compared to the general population, but interestingly, it was older on average than the trans people counted in the census. So make of that what you will. We reached older trans people than the average. Tips on how to support trans teens. I think as well, probably not going to do justice to that whilst trying to do a big Q&A on the findings of the research report. I think the most important thing though is to be there for people, to let them know that whoever they are, you'll support them, and that while they're exploring and figuring out what they want to do with their lives, you're there to listen, and to be non-judgmental and as much as you can to sort of be a bit of a cheerleader when you can be. Um, okay. A lot of questions coming in right for in the end that I'm not going to be able to answer all of. So let me have a quick read and I'll see if there are any that are quite different that I can maybe answer. Okay, I think I'm gonna answer one around neighborhoods, because I think it is a really interesting one. And it was the first time we'd asked these kinds of questions, I guess, around people's experiences of like place. And I think one thing that we often find in terms of when public bodies or governments think about trans people is that they tend to very much think of us as a community of identity. And we're very rarely thought of as like people who exist in geographical places as well. So it was quite interesting. Like Flo mentioned when she was doing the presentation, we thought some of the kind of stats on what people thought of their neighborhood were quite good in terms of they overall seemed pretty, people were kind of in the majority pretty positive about where they lived and people in their local areas. But it was just that when we looked at it compared to what the general population said, that it seemed like it was much less positive. Um, we we're not as sure about what the answers about that are, but we think that one really important thing is to make sure that trans people, and in fact LGBT people more generally, because some of our respondents mentioned kind of being perceived to be visibly not heterosexual as well as having an impact on their experiences. We think one of the most important things is just getting it on the table that we're a community that needs to be thought about when we kind of talk about things like community cohesion, when we think about things like kind of fostering good relations and between communities in local places. Because we think right now, actually, most of the kind of organizations responsible for doing that kind of work probably really don't think of trans and non-binary people when they're thinking about it. So yeah, we kind of see that one as one to which we don't have all the answers just yet, but we know from doing this research that it's a question to pose, I suppose, and one that we need an answer to. Um, so we have both a research report and a survey report, and a summary report, which so the summary report is the one that will give you the highlights of our questions and answers from the survey, and our research report is the one that will give you the answers to every single question in extreme detail. Some of you please read it because otherwise it will make Flo and I very sad that we wrote it. Um, right, and I'm just seeing if there are any others that I have time to answer. Oh, there's a question about criminal justice. So we didn't ask about any other criminal justice agencies except for Police Scotland. The way we kind of thought of our public services section is we kind of wanted it to be about services that you just might need to use or would encounter within your everyday life and not kind of specifically or not always specifically because you were a trans person, I guess. And we didn't want to end up in a situation where we had a list of like 25 public services, given that we were asking people about 103 questions. So no, unfortunately, the only kind of info and data that we got around criminal justice stuff was around experiences with Police Scotland. And similarly, someone's asked a question about hesitancy around mental health support and services. So again, that wasn't something that we asked about this time. The we did many years ago now in 2012 do a big trans mental health and well-being study that's still available on our website. We did that in partnership with a few academics at universities. Um, Definitely, I would say from working with trans people that it's not, it's obviously not up to date exactly. But when I do look back at the stats and things in terms of what people think about accessing mental health services, it's probably unfortunately still relatively a decent picture of where people's experiences are. Um, Okay, well, as it's 1 minute to two, even though I'm very adept at speaking at the speed of light, I don't think I'm going to manage to answer any of the other questions. But what we will do is we'll have a look at the ones that we didn't have time to answer and do we email out to everybody, both who came and also who signed up for a ticket, just letting them know what the answers to those are. And we'll also see as well the ones that I've answered out loud rather than the ones that I answered via text while Flo is presenting. We'll maybe see if I can attempt to remember what I said to those too, so we can send that round to everyone who was here and also, yeah, to people who couldn't make it. But thank you very much to everybody for coming. We really appreciate you taking the time today.